So let's talk briefly about the term queer. So is it a bad word? Can I say it? What does it mean? So queer is basically a big umbrella term for anybody that isn't straight and cisgender. So anyone in that long acronym I brought up at the very beginning is queer. It has definitely been used as a historical slur in the past. Same thing with dyke, for example, although dyke is definitely becoming reclaimed, but less so. So queer, I don't usually use it around my patients who are older unless I hear them say it first, because they may have grown up in a time and a place where this was used in a really harmful way. But now it's changing as a way to mean like all identities that are not cishet. So, or some folks will say, like, for example, I go to a lesbian literature book club, and at the beginning, one of the organizers always says, like, welcome to lesbian literature book club, inclusively and expansively defined, meaning like a space for non-straight women to gather, or non-straight non-men to gather. So queer is used as a way to say, like, I'm in this community. Or for some folks, they don't have a label to identify themselves. So let's say someone who's non-binary and they're attracted to men. Well, they're not straight because they're not a woman, and they're not gay because they're not a lesbian. They're not bisexual because they're not attracted to two groups of people. They're not pansexual. They're not asexual. So what are they? They don't have a term, right? We don't have the labels. And so I know a lot of people are like annoyed that the label keeps growing, the acronym keeps getting bigger, but they don't have a label to describe themselves. And so they just use queer because that's the only one that they can utilize.